everyone, Dr. Kelvis here to speak a little bit on heart disease in the United States. And we're going to break this up into two parts because I have a lot to say. Okay, according to the CDC, over 1.5 million heart attacks occur in the United States each year, with heart disease being the leading cause of death in men and women. A myocardial infarction, or MI, is the formal medical term for a heart attack. And this happens when heart muscle tissue, better known as like myocytes, do not receive enough oxygen. And myocytes cannot survive any prolonged period of time without oxygen and immediately die. So coronary arteries deliver oxygenated blood to heart cells, which then allow them to contract. And when all of the cells within the heart contract in sync, it results in a heartbeat. So myocytes generate electrical current, which is what allows the heart to pump in such a way as to move blood through a one-way circuit, throughout the body. Many things over time cause coronary arteries to become diseased and clogged, which prevent oxygenated blood from reaching the actual heart tissue. A lifetime of high cholesterol and diabetes, for example, can cause this. The medical term for artery disease, due to high cholesterol is called atherosclerosis. It's a mouthful. Symptoms, can be extreme and obvious, such as acute onset of chest pain that, radiates to the left arm, the neck, or the jaw. But it can also be very subtle, especially in older populations. Sometimes in a very old, or I shouldn't say that, a geriatric patient, someone maybe over 70 years old, the only symptom is sometimes generalized fatigue and muscle weakness. In those with diabetes, the nerves that carry sensation become dampened by a lifetime of elevated blood sugar, making the typical chest pain prodrome even more insidious. Those patients may not feel pain at all, but may just pass out. And the medical term for that is called syncope. So a true heart attack, true heart attack chest pain is easily mistaken for acid reflux and vice versa. A quick way to differentiate this pain is to ask if the patient has a known history of acid reflux and if their symptoms are quickly relieved with taking an antacid, such as Tums. True cardiac chest pain, of course, will not be relieved with antacids. Most patients that suffer a severe MI, they do not recover, and unfortunately, they die from cardiac arrest. And cardiac arrest is essentially just when the heart actually stops beating. Sometimes a coronary artery may be only partially clogged. Studies show that pain and symptoms arise when a coronary artery is approximately 70% clogged, which will then manifest in chest pain with exertion. And chest pain in the medical community is called angina. If a patient experiences chest pain that is relieved within 20 minutes of resting, this is called stable angina. Unstable angina is the term given to chest pain that persists past 20 minutes despite resting. And that warrants immediate transportation, to the nearest emergency room. Cardiologists have a few types of medications that patients can take to relieve stable angina, like nitroglycerin, but this should only be done under close supervision and, of course, after completing a full cardiac workup. If a coronary artery becomes more than 90% clogged, they are at high risk of suffering a fatal MI. In the emergency room, patients will have several urgent labs drawn to determine if any cardiac myocytes have died or if they're under stress. And these little proteins that we look for in the blood are called troponins. And this lab can be elevated for a number of reasons, such as severe dehydration or sepsis. But in the setting of chest pain, elevated troponins are an excellent quick method for assessing if the heart is under stress. We'll also get what's called an electrocardiogram, an ECG, or formerly known as EKG. So an ECG will be performed in the ER to assess for any electrical changes in the heart. When myocytes are under stress or they die, they can no longer conduct electricity in a normal pattern. And this will show an altered electrical pattern on the ECG, which then alerts the physician that a coronary artery is clogged and the patient needs urgent surgical intervention.